In patients with human epidermal growth factor receptor 2 positive breast cancer treated with neoadjuvant chemotherapy and HER2-targeted therapy, the risk of cancer recurrence is higher among those with residual invasive disease than among those without residual disease. Trastuzumab emtansine is an antibody-drug conjugate of trastuzumab, a HER2-targeted therapy, and the cytotoxic agent emtansine, a microtubule inhibitor. Trastuzumab increases intracellular delivery of emtansine to HER2 overexpressing cells. In this multicenter randomized open-label trial, 1,486 patients with HER2-positive early non-metastatic invasive breast cancer and residual invasive disease after surgery who had completed neoadjuvant chemotherapy with trastuzumab were randomly assigned to 14 cycles of trastuzumab emtansine or trastuzumab alone as adjuvant therapy. The primary endpoint was invasive disease-free survival. Safety was a key secondary endpoint. The primary endpoint was significantly higher among patients who received trastuzumab emtansine than among those who received trastuzumab alone. At a planned interim analysis, invasive disease or death had occurred in fewer patients who received trastuzumab emtansine than in those who received trastuzumab. At 3 years, it was estimated that 88.3% of the patients who received trastuzumab emtansine would be free of invasive disease, as compared with 77.0% of the patients who received trastuzumab. Adverse events of any grade were more common in the trastuzumab emtansine group than in the trastuzumab group. The most common adverse events of grade 3 or more were decreased platelet count and hypertension. The authors conclude that among patients with HER2-positive early breast cancer who had residual invasive disease after completion of neoadjuvant therapy with a trastuzumab-containing regimen, the risk of recurrent invasive disease or death was lower with trastuzumab emtansine than with trastuzumab alone. Full trial results are available at NEJM.org.